Coalition webinar series. This is the sixth of our series of Learn and Connect, and hopefully you're on the right one. This is the Policy 101. So we are super excited to be bringing this training to you guys. This one was highly requested from our survey that we sent out, and so hopefully you guys will all be able to bring something back to your organizations or work after this training. So today we have Carleigh Olson and Mike Metcalf, sorry Mike, who are going to be presenting on Policy 101. And so I'm going to take a second to introduce them. So Carleigh is the Policy Training and Technical Assistance Coordinator, which is a collaborative position between the Wisconsin Division of Public Health Tobacco Prevention and Control Program and the Match Group. Carleigh has served in a number of different roles where she has coordinated and facilitated local coalitions, conducted a health impact assessment, fostered Board of Health engagement, and supported national accreditation processes. And Mike is the program and policy analyst for the Wisconsin Tobacco Prevention and Control Program. He is responsible for assisting with the assessment, review, analysis, and development of recommendations for statewide and local tobacco control policies. And Mike enjoys getting into the outdoors and spending time with family. So yeah, now we know a little bit more about our presenters and their backgrounds. So hopefully you guys could find some similarities there. And yeah, we are just super excited to have both of them on board for this presentation, and very lucky to have them on board. So without further ado, I'm going to pass it over to them, and I'll watch the chat box in case any questions come up. If you have any larger questions throughout, we'll try and save them for the end. But if there's something urgent or a remark that you want to share, feel free to type it in there, and I'll be kind of watching that throughout. And if you guys have any questions for me, feel free to stick them in there. I just realized I never really introduced myself. I am fresh off of maternity leave, and so jumping back into work and messing everything up apparently. But I'm Megan Otto, and I'm one of the members on the Northwoods Coalition team, and I coordinate and set up all the trainings for Northwoods Coalition. So that's a little bit about me, but yeah, let's jump right into it because I know they have a great presentation here.
Thanks, Megan. You're doing great. Yep. No worries. Cool. Okay, so I'm going to share my screen. Okay, so like Megan shared, Mike and I are here. We work for the Tobacco Prevention and Control Program, and we both work on policy. And that looks really different for both of us, and we do a lot of work together. And so we put together this PowerPoint, you know, in the hopes that this will address your questions and, you know, hopefully teach you something new or reaffirm something that you already knew and you just needed to hear it again. And if there are more questions or other ways that we could answer your policy questions, please ask. You know, the Policy 101, you know, we're providing a really high level. And so we know that there are lots of nitty-gritty questions that may not be covered in our initial presentation. So hopefully we'll hit the big pieces, but if you do have more questions, please don't hesitate. And chances are if somebody didn't have that question, they may not even known to ask the question. So, okay, so our plan together today. So we're gonna just do some background on tobacco prevention and control so that you know where we're coming from when we think about these things. We're gonna dive into some general policy 101, and we're gonna focus on the state level and the local level, and then answer your questions. So that's really how we're going to proceed, and we're excited to get started. So you might note on our cover slide here, we say commercial tobacco and policy change. This is an intentional choice. I want to elevate that when we talk about tobacco in the context of this presentation, we're talking about commercial tobacco, not traditional tobacco, which has a very different meaning and really, meaning for Native communities that we work with. So just to really make that distinction clear. Okay, jumping in. So some quick facts. So, thinking about this tobacco prevention and control landscape, and this really may not be new for some of you, and for others, it may be very new. So, um, in thinking about what's going on right now you've maybe heard of the e-cigarette epidemic. And, I think more people are familiar with the terms epidemic, pandemic, given the moment we're living in. However, we know that e-cigarette use in our youth populations has skyrocketed over the last few years. And many of you work with these folks and know really well how much of a problem this is. So our data is showing that 1 in 5 Wisconsin high schoolers are using e-cigarettes. However, we also know that when we talk with young people, they say that that's really a lot higher. And maybe some of that is perception. They have peers that use, and so it feels like more people are using, and also it could be that more people are using than is captured in our data. And I'll just go over a couple more of these. We also know that 89% of young people say they would not use unflavored tobacco products. So when we talk about flavors, we mean anything from menthol, we mean mint, we mean mango, fruit punch, you name it, all the flavors. One day we moved offices in our DHS building, and obviously this was before the pandemic, and we had an open house so that our colleagues knew where our new offices were. And so what we did was we were all different e-cigarette flavors, and I chose cheese. Yes, there is cheese e-cigarette flavor. Can you believe it? I don't know why anyone would want that, but it feels notable given we live in Wisconsin. So, and then another important note is that more than half of current smokers usually smoke mentholated flavored cigarettes. So there are a lot of different intersections that come with tobacco use. So, think about tobacco use as this overarching concept. You have subpopulations, you have ages, you have race, you have lots of different intersections going on that drive different kinds of use, right? So just know that, it's a broad topic with lots of different intersectionalities happening. Okay, so a bit about adults and tobacco. So, the Wisconsin adult smoking rate is, at record lows, 16%. And many of you know on this call that if you dive further into the data, you uncover a different story. And the story tells us that folks have been targeted by the tobacco industry more than other people. So certain populations are, targeted based on race or based on income. And we know that the industry does this. I saw a report the other day in the last year that the industry spends $1 million a minute on tobacco advertising. So this is obviously a huge industry that we are up against, and we know that certain people are targeted more by these advertisements and by placement of where these things are in communities. So leading into that, we know what works to control and prevent tobacco use amongst our populations. So there's a lot of talk about vaccines lately. I don't know about you all. I was reassigned on COVID response last year, so this is really on my mind. I recently got my COVID vaccine, so feeling good about that. But long before we had a COVID vaccine, we had a tobacco prevention and control vaccine. And you may be chuckling a little bit, but it's true. This is a concept we've worked with for a very long time. So what is in the tobacco prevention and control vaccine? So we know the things that work: tobacco price increases, such as tax increases, minimum price limits. So say, a pack of cigarettes needs to cost a certain amount, e-cigarette taxes, things like that. Youth are our most price sensitive customers. So we know that if we increase taxes or the price of a product, they will be priced out. What else works? Smoke-free policies. So we'll talk a lot about this later and just what's been going on statewide with smoke-free policies, but we know smoke-free policies work. And part of why this works is because it sets a standard for what we do and what we see other people do. So if you're not allowed to smoke in a restaurant or in your workplace, it doesn't show you, right, that that happens. And so it's this reinforcing message that, this isn't socially acceptable in these places. We know that hard-hitting media campaigns work. I always chuckle a little bit when I read this one because I'm not a media person. I'm going to say that right up front. He is not on the call today. We have one of those, and I rely on him heavily. And I don't know the difference between hard hitting and not hard hitting, but I hope they're good media campaigns. So I always just laugh a little when we talk about it, but you hear it all the time when we talk about media campaigns. So, and maybe one of you knows, and you can educate me, but we've got a campaign out right now, and probably you're familiar with it. It's called Tobacco is Changing, and it has gone through many different iterations, and we're in launching a new phase right now. So really exciting. Encourage you to Google Tobacco is Changing in Wisconsin, and the website will come right up. We know that cessation access is critical for people to be able to quit. So, when we do the things like price increases, make it harder to have, make it less socially acceptable, we need to do right by our people and get them the cessation resources that they need so they can quit if they choose to quit. And then the vaccine booster is the retail environment. And we'll talk about this a little bit later, but really important to recognize that so much of access to these products happens in the retail environment and, in our corner stores and in our gas stations. And there's certainly a huge market online as well. But we know that if we're able to control the retail environment, say, keeping all products behind the counter in a locked case so that kids can't just grab them like they would grab candy, or, making sure that advertisements are, possibly not there or controlled in a certain way. All of these things contribute to, if there are increased sales. And it makes sense, right? Why do you market? Because you want to make a sale. So that is the tobacco prevention and control vaccine. So now you know. So I sort of talked about this a little bit, but just a note on cessation, because we really always want to bring this up. With increased youth using products, we also know that there's a lot of young people who want to quit and who have tried to quit. And we'll be the first to say that youth cessation is really challenging. There are a lot of ethical considerations for folks who are under, now 21 with the federal, T21 law, but traditionally under 18, and not being able to give them what we give adults as nicotine replacement therapies. So I'll just acknowledge that it's a challenge to get the right sort of things for youth. But I think the field, my opinion, is the field is moving along, and we're getting there. So I have on the side here an image of the Wisconsin Tobacco Quit Line, which was recently revamped and looks super inviting. And just want you to know that the Quit Line is available to any Wisconsin resident who's at least 13 years old. So they can call and 18 plus. So this is sort of that nuance that I was talking about, are able to get 2 weeks of free mailed medication to their door. And the Quit Line also has a text to quit program. So if you go on this site, you're able to do the drop downs and you'll see the text to quit program, which is another great option if somebody doesn't want to make a phone call. We know that people don't always want to talk on the phone around insensitive things to a stranger, right? So maybe calling someone feels really hard, and so texting might be easier. We also have a specific American Indian program that includes quit coaches who have been trained to have culturally tailored support, and that program has 12 weeks of free medication. And one other quick note that I think not a lot of people know about, if you are working with people who are on Medicaid, Medicaid does cover quit medication, and it's a super awesome option for longer cessation support. So longer than that 2 weeks of free medication. So just keep that in mind. Okay, I'm going to pass it over to Mike.
Okay, awesome. Thank you, Carleigh. I just want to reiterate one thing that Carleigh mentioned, and that is that we are here to serve as a resource. If there is something that we talk about today that you're interested in or that you're not quite grasping, please reach out to us. We have resources that we can share with you, and we're more than happy to talk through all of this individually. So I just want to make sure to highlight that again. So I'm going to be going into more of the policy making process here in Wisconsin, and then connecting that to a lot of what Carleigh just talked about, and specifically commercial tobacco or tobacco prevention and control. Next slide. So before I really jump into the policymaking process, I want to talk about three important terms that not only are we going to be talking about in this presentation, but are really important pieces to the policymaking process. And those three words are lobbying, advocacy, and grassroots lobbying. So I'm going to walk through each of these. So lobbying is any verbal or written communication with a legislator or government official that where you, one, you refer to specific legislation, and two, you express a position or opinion on that legislation. So there's really two important pieces there. One, you're referring to a specific bill or a specific piece of legislation, and two, you're expressing a position on that legislation. Advocacy, on the other hand, is the process of attempting to bring about social or organizational change on behalf of a particular health goal, program, interest, or population. Health advocacy includes educating policymakers and the public about evidence-based policies. So the key word there is educating. So advocacy is where we're educating the policymakers or the public on evidence-based policies. And one important note that I just want to make clear is that it is not lobbying to talk to a legislator about the health impact of a specific piece of legislation. I think that can be confusing at times, as long as you don't state a specific view on that legislation. So to give you some kind of concrete examples to help you wrap your mind around this a little bit. So lobbying would look, what would lobbying look like? What that would look like is if you went to a legislator and said, hey, we're asking you to vote in favor of Bill X, and this bill increases funding for tobacco cessation programs in local health departments. So you're referring to a specific bill and you're asking them to vote in favor of it. Advocacy, what would that look like? That might be where you go to a legislator and say, hey, local health departments are key players in preventing and reducing tobacco use through clinical and prevention strategies. So you're not really referring to a specific piece of legislation, but you're just educating the legislator. And then grassroots lobbying, what's that? What's the difference there? So grassroots lobbying is any attempt to influence legislation by encouraging the public to contact legislators about legislation. So you're really working through the public to make that change. According to federal law, indirect attempts to communicate with and influence legislators would be considered grassroots lobbying if the communication refers to specific legislation and encourages other people to express a view on the legislation to their elected official. So some examples on this would be asking volunteers to call their legislators and ask them to support or oppose part of the state budget. That would be grassroots lobbying. Another example might be writing a letter to the editor or a newsletter column telling readers to contact legislators and ask them to support or oppose specific legislation. That would be grassroots lobbying. So kind of got into the weeds a little bit there. Hopefully you're still with me. But I think those are three important pieces of this process that we want to highlight. And again, if you have any questions about, where do I draw the line? Or is this lobbying? Is this advocacy? Can I do this? Can I not? Please let us know. We're here to help. Next slide.
Mike, I was just real quick going to add, I think too, it's important for you all to think about and ask your organizations what this process looks like, because if you're grant funded, that might dictate how you can interact in this process. If your organization has certain rules, or maybe they have their own policy process and they don't want staff to be a part of that, I would just encourage you all to read up on your own organization or funding rules to be able to figure out how to, intersect in this process. But just to say, you're also a person who lives in Wisconsin and can talk to their legislator on your own time, on your own dime. So, don't use your work computer if you're not allowed to do it at work. Use your own personal email, all of those things. So just remember that, you are an important part of the policy process as well, being a resident who has elected officials who serve on your behalf. So sometimes I think we forget about that when we put on our professional identities. Okay, Mike, I'll go back on.
No, that's a great point. Thank you for including that. Okay, so next I'm going to get into a little bit about the Wisconsin state government structure and what that looks like. So here in Wisconsin, we have a bicameral legislature. So what that means is there are two houses that vote on proposed legislation. You can see here it's split between one house is the Senate and the other house is the Assembly. And in order for a proposed bill or a proposed piece of legislation to move forward, both the Senate and the Assembly have to vote and have to agree on that proposed bill in order for it to then send it to the governor to become law. And I'll get into the details a little bit on that later on in the presentation. But so essentially the Senate and the Assembly have to agree by voting on proposed legislation. Just to give you a breakdown of what our legislature looks like. So it's made up of 132 legislators, 99 assembly representatives, and 33 senators. The state is comprised of 33 Senate districts, and each district elects one senator. Each Senate district is then divided into 3 assembly districts, so 99 in total. Which each elect an assembly representative. So every home address in Wisconsin has both a senator and an assembly representative. Assembly representatives have 2-year terms. Senators have staggered 4-year terms. And every 2 years, we vote on either the odd numbered state Senate districts or the even numbered state Senate districts. So it's fairly organized, and there is a process to the makeup of the Senate and the Assembly. Next slide. Okay, so how does a bill become a law? I think this is, if you think back to your Schoolhouse Rock elementary school days, this is gonna kind of hit home to you. And you'll be able to make a lot of connections. But what I'm going to do is I'm going to kind of walk through what the process looks like here in Wisconsin. So the first step, starting in the upper left icon, the bill is introduced in either the Assembly or the Senate. Once it's introduced, that bill is assigned to a committee. And that committee studies the bill and holds public hearings. Once that is completed, the committee votes and then refers the bill to a rules committee where the bill is debated and then amended before final passage. So that's just one side so far. That's just one side, either in either the Senate or the Assembly. Once it's completed on that one side, it then goes to the other house, where it goes through a similar process. And if amendments are made, the bill has to go back to the other side and they have to agree on it as well. So there's a little bit of this back and forth game. But once both houses agree, the bill is then sent to the governor, or I guess there's a vote, and then it's sent to the governor, and then the governor can either sign the bill or veto all or part of it. So as you can see, there's a lot here. There's obviously a lot more to this process than what I just explained or what's on the screen. And you can really see how this process can be a long and winding road, but this kind of gives you an idea of generally what it takes for a bill to become a law here in Wisconsin. And again, if you have questions on this, we have resources that we can share with you. Next slide. Okay, so another way that proposed policies or legislation can be signed into law is through the state's budget process. So Wisconsin has a biennial budget process, and what that means is the governor proposes a new budget every 2 years, and the budget determines how money will be spent over a 2-year period, and it really sets priorities for the administration, and it can include policy initiatives that have fiscal implications. As you might know, we're currently right in the middle of this process. So we're currently in an active budget cycle. And I just want to reiterate that the budget really sets the priorities for the current administration and is a policy document. So it's an important piece of the policymaking process here in Wisconsin. Okay, so Carleigh, if you could go to the next slide. Now what I'm going to do is kind of go through each phase of this process. So the first step is the governor proposes his or her budget in January or February. You might know this. So Governor Evers just released his budget proposal. I think it was in early February, if I remember right. The next step is the Joint Finance Committee holds public hearings on that proposed budget. And this is currently where we are right now. And then from there, step 3, the committee makes changes, votes, and then sends it to the Assembly or the Senate. And then from there, changes are made in one house and then sent to the other for more changes before the final step where the governor reviews, vetoes portions, and then signs it into law. So just to kind of focus or bring this back to the real world, what we're seeing right now, so you can kind of make connections. As I said, we are right where that orange dot is. And I believe it's next week, the Joint Finance Committee is holding a virtual listening session. And then this is also a place where you can provide written testimony on any piece of the governor's budget. And just to give you an idea of what is included in the budget specific to tobacco that Governor Evers has proposed, there's really a lot, so I'm not going to go into all of it. But some of the highlights are he has proposed adding e-cigarettes to the smoke-free workplaces law. He's proposed funding a one-time $2 million media campaign for tobacco and e-cigarette education. He has proposed updating tobacco-free school policies to include e-cigarettes and vaping. He's proposed raising the age to purchase tobacco from 18 to 21 to make it in accordance with federal law. He's proposed licensing vape shops, increasing e-cigarette taxes. So there's really, and a couple more, so there's really a lot he has included in his budget. So we're anxious to see how this goes over the next couple months and how things play out, because a lot can come and go. A lot can change between step 2 where we are and step 5. There's still a lot that can change. So we're anxious to see how this plays out. Next slide. Okay, so one important note, Carleigh, if you could go back one slide. There's an important note that we want to mention on electioneering. So keep in mind that coalitions are subject to electioneering scrutiny. So it's important to keep communications the same to all candidates in a specific election. So actions cannot be misconstrued as electioneering. So Carleigh, I'm not sure if you have anything you want to mention on that, but I think it's important to recognize.
Yeah, so just like Mike said, you know, many of you work with coalitions or work with community members, you know, there are so many elections all the time, right? And so what Mike is talking about is, you know, when you have an election cycle, so sort of shifting away from the budget, but when you have an election cycle and you have candidates and you have maybe incumbents, which are the people who were in the position before and they're running again, but they have to run again. You need to make sure your coalition or your volunteers communicate the same to everyone in the race. So let's say you have a candidate and the incumbent. If you're going to ask to meet with the candidate, you have to offer to meet with the incumbent. So it's really meant to be fair and give everyone a chance to engage with the community. So we just wanted to make sure to say that, because I think, at least I'll just say out loud, before I started in this position, I did not know this. So just so that you know, before we switch gears to talking about preemption.
Yep. Thank you, Carleigh. Okay, so we've covered a lot so far. I maybe want to just take a quick breath. If anyone has questions up to this point, go ahead and put them in the chat. I'm going to keep moving along, but feel free to put those questions there in the chat for anything we've talked about so far. Let's see, Carleigh, next slide. Okay, so I'm going to talk a little bit about preemption. And this is a word that maybe you've heard, maybe you haven't, but even if you have heard it, there might be some confusion around what is preemption and how does it apply to tobacco prevention and control. So I'm going to go into this a little bit. So what is preemption? That's the question. This is when a higher level of government has the authority to limit the power of lower levels of government on specific policy issues. So you can see on the image to the right, you basically have the federal, state, and local levels. And preemption is when a higher level of government, like the federal level or the state level, has the authority to limit, like the local level, on specific policy issues. A part of preemption too is a policy at a lower level of government cannot be stronger than the higher level of government. And tobacco regulation policies are sometimes regulated with tobacco or with preemption. So one example of this to, again, help you kind of wrap your mind around it is raising the minimum legal smoking age to 21. This has to be done at the state level. Local jurisdictions and municipalities cannot raise the legal age to 21 in their local area. It has to happen at the state or federal level. And I'll get into a couple more other areas where this applies. But another couple examples that are connected with preemption in Wisconsin are restricting single-use plastic bags and then setting a minimum wage above the state minimum. And I mention that just to say, this isn't just a tobacco issue. Preemption can be included in, just about any policy issue or area. Next slide. So you might be asking yourself, well, what is preempted and what isn't? I kind of broke this slide out into both sides to give you an idea of what can be done at the local level and what cannot be done because of preemption. So on the left-hand side are different tobacco related policies that cannot be done at the local level due to preemption. And that is, those are taxation, age restrictions like Tobacco 21 that I mentioned, youth access like product placement and advertising, and then smoke-free outdoor spaces around businesses. But there are certain policies or tobacco-related policies that can be done at the local level, and those are on the right-hand side. So clean indoor air in workplaces. Right now, we're seeing a lot of local governments updating their workplaces law to include e-cigarettes, clean indoor air in government facilities, tobacco-free public lands, and also zoning restrictions on retailers. And then I also just want to note that this is how we currently understand preemption in Wisconsin. And this really goes back to a court ruling in the early 90s. And we know that the industry uses preemption as a tactic to limit prevention and control. So it's really a tactic that they've kind of latched onto and are using. You might wonder how we can get rid of preemption, or is it even possible? And the answer is yes, but it's complicated. It has been done, and even recently in other states, localities can make a decision to explicitly challenge preemption by passing a policy that would otherwise be preempted. But that does come with a lot of risks, such as a legal battle, and it can get very expensive. So we just want to highlight that. Next slide. And I believe at this point, I'll kick it back over to Carleigh.
Awesome. Thanks, Mike. Exactly what the slide is saying. What is our role? And I'm going to operate under the assumption that most of us are funded on restricted dollars, meaning that we cannot lobby on work time, okay? Which is true for me and Mike as well. So our role really falls into this educational advocacy space. And, it's important for us as subject matter experts, as public health experts, or, community members to share how we feel about what's going on in the legislative process. Because after all, these people work for us, and just to really drive that home, they really do work for us, right? We pay their salaries, they represent us. And so it's just so important for you to feel empowered to engage with your policymakers to tell them what you need. So what this can look like through the educational advocacy frame is providing our elected officials and stakeholders education, teach them about what you're an expert in and what you care about, tell your story and how you, what it means to you. Talk to them about best practice policies that, you feel like will be a solution. You can organize community events. So, pull your people together, probably virtually right now, hopefully soon in the near future, in person, organize those events and get people talking about your issue and what kind of solutions there might be. Giving presentations, just like Mike and I are doing right now. You could give a presentation to your school. You could give a presentation to your local board of health. All of these people are important people to educate. You can provide public testimony to your decision makers. So like Mike was talking about with the Joint Finance Committee coming up, there's an opportunity to provide written or verbal testimony. And you can also do that at other times. So if you think back to the slide that Mike was walking through, where the different steps of the policymaking process, I think of all of those things as, while yes, they are points of the policymaking process, they're also advocacy points. I bet you could find at every point in that process an opportunity to advocate for what you care about and educate folks on why it matters. And so, if they have a committee hearing on a specific bill, you could give verbal testimony and educate about best practices around that bill or that topic. And other options are writing a letter to the editor or doing a press release, getting that media attention on your issue area. Ultimately, what it comes down to is using your local coalition and the folks that you work with in your community as a catalyst for change. And I come from a strong belief that really meaningful change happens at the local level. And, you all play a really important role in supporting that process and helping people realize that they have power in these systems to use their voice. And then lastly, we just wanted to touch on the importance of centering health equity in these policy processes. This can look like a lot of different things. And you've probably been hearing lots about health equity and what this could look like. And there are different ways that you might build this into your policy making or your policy, educational policy work. So maybe you use a different assessment tool. We use one called the Racial Equity and Social Justice tool, where you can walk through and it asks you a series of questions to sort of get you to pause, think about, what are the unintended consequences of this policy? For me, I think about this a lot. Like I was sort of mentioning before, when we increase taxes on products, that can be really harmful for people who are targeted by the industry, who maybe they don't have a lot of money and they have an addiction. And so how are we going to work to mitigate those unintended consequences for those people? Because they're a critical part of our community as well. And ultimately, I think it comes down to building relationships and involving your communities, doing those one-on-ones, meeting with, leaders and talking to them about, what you care about and striking up that relationship so that when you get to a place of wanting to educate on your issue area, you've built a network of people who understand, the importance of what you're talking about. Okay, so just a quick touch on local policy. So we've focused a ton in this conversation on statewide policy. However, I just told you and revealed to you how much I love local policy action. So I'm going to take a second to dive into this a little bit more. So if you didn't know, you'll know now, there has been a huge influx of local policies happening throughout Wisconsin. So the number one policy that has been passing throughout the state related to tobacco, and remember, only certain things can be worked on because of preemption, which is quite limiting, is including e-cigarettes in local smoke-free air laws. Or ordinances, I should say. So this policy has been wildly popular on the local level, and we, I don't have the map pulled up here, but we do track these policies and we've got a map, plotting. It's nothing fancy, right? I'm not a GIS expert, but plotting where these policies are, and, they're all over the state, which is super exciting that folks are covered by these ordinances. So I'm going to walk through each of these points on here and also kind of share about the process. We've talked a lot about policy process, right? The process that might happen at the local level. So just to tell you kind of my plan. So like I was saying, this specific policy has been super popular, and now 39.2% of Wisconsinites are covered by a local ordinance that includes e-cigarettes in their smoke-free workplaces ordinance. Holy cow, it's a lot of words. So super exciting that many municipalities have said, like, hey, we don't want e-cigarettes in our workplaces, and this includes bars and restaurants. So to pass a policy like this, you might be kind of wondering, so how does this even show up on the local level? And you might be wondering, did this happen in my community? And if you're curious, I can look it up for you. But essentially, if we reflect 10 or so years ago, the state passed the statewide smoke-free air law. So which means that you can't smoke cigarettes inside in bars and restaurants. So many municipalities, sort of what is happening right now with e-cigarettes. So many municipalities before the state passed that law had already passed their own local policies. And so this is sort of what happens, right? So there's local momentum on an issue, and then, the state takes action on it. It doesn't always happen that way, but we see that happen a lot, where it's a sort of grassroots movement and then the state will follow. And I mean, just to take it in a totally different context, right? You kind of already see this happening with marijuana. So states, just to give a different example, states are passing marijuana legalization, even though it's illegal at the federal level. And I would expect probably at some point, the federal level will take action. In what way, I have no idea. But just to sort of give you another way of thinking about how those things then make change. So back to tobacco. So a lot of these municipalities have already passed their own local ordinances many years ago. So if this is the case for a municipality now, all that they would need to do is amend a couple of definitions, and then they'd be able amend and add a definition, and then they'd be able to say, yep, e-cigarettes also are not allowed in our workplaces. So it's really quite easy, which is also probably why it's been, pretty popular over the last few years. Policies like these are typically passed by a city council or some sort of decision-making body like that. So maybe you have alders in your community, or, county board members, something like that. Those folks who have the highest elected decision-making power would be the people who would vote on a policy like this. But there might be other ways that it shows up first. So maybe it goes through your local board of health, or maybe it goes through some other type of committee before it shows up at the city council. So that's possible. Okay, so another policy that's been popular is commercial tobacco-free outdoor spaces, which would include like parks, beaches, event spaces, things like that. Mostly we see it show up in parks. So it'd be like a tobacco-free park. And these policies, have a similar pathway to the one I just mentioned, but they might look a little different. So maybe they first go through the parks board, if you have a parks board, or some other parks related decision group, and then to the city council. So let's say you're like, I really want a tobacco-free park in my community. I think this is the right best practice to go for. Maybe it would make sense to meet with your parks director and see what they think. Do they think this is a problem? Would they want to weigh in on this? Because the last thing you'd want to have happen is this policy is moving along in your community and the parks director says, no, that would be pretty hard to share why it's still important if your parks director isn't on board. Not to say that it hasn't happened, but just to say, you want to know who the people who have decision-making power, where they stand on some of these things before you move along. And then the last one I wanted to talk about was tobacco-free schools. And we've seen a ton of movement happen on this policy, and you can understand why. And this really does follow a completely different path than the last two that I mentioned. The deciding body would be the school board, and many times wouldn't go to a city council. We have seen it go to a city council, but most often, the school board would be who would make this decision. It's worth noting that we have been doing a lot of work with tobacco-free school policy in the last few years, and we came across that there's a private company, and maybe some of the schools you work with this company. They're called Neola, and they basically provide model language on all kinds of school policy to schools. And it like I said, it's a private company that provides this service, and the schools pay for it. So we discovered that Neola was doing this for tobacco policy, and we struck up a relationship with them, and they ended up taking our best practice policy, and now all of their clients will have the option to adopt this best practice policy, which is super exciting because it's a big, pretty rapid win when you're talking about moving one by one through every different school district. So with that said, we've had a lot of school policy change to include e-cigarettes, and we're starting to shift focus into non-punitive enforcement. So maybe you've heard of this concept. Essentially, it is to support young people in the fact that maybe they were caught with a product and not punishing them for having that product, and rather offering them support and services so that they can choose to quit if they're ready, rather than getting them into the legal system. So that could be a whole other talk, and we won't go down that path, but that is an emerging work for us and all the coalitions statewide. So that's a bit about local policy, what we're seeing as being really popular. There's a couple of other local policies that we're not preempted on, and I'm not going to go into those today, but we are actively working on building out some technical assistance support on these so that folks like you have access to lots of different options when you're thinking about fostering change in communities. So with that, we are happy to take questions. I will stop sharing my screen. Really happy to do verbal questions or chat questions. I see there's a bit in the chat, so I can check that.
I saw one question from Sharon. Do all the state taxes collected on commercial tobacco products go to smoking cessation programs or related health programs to mitigate for addiction? Carleigh, correct me if I'm wrong, but I believe the answer is not necessarily. They kind of go to a general fund, and then that money is then allocated to different state programs.
Yep, that's right. So within Wisconsin, the answer is no. There are not $0 of the tax revenue goes directly to funding these kinds of programs. It's not earmarked in any way. That's how we would talk about that. In other states, maybe. So that's possible. And usually when we are trying to provide, education on why taxes are important, it's usually coupled with, and we should earmark those funds for cessation services and educational programming, but it has not yet been successful in our state. Are there any other questions that folks have? I know we went over a ton. So Sharon's asking in the chat, does Wisconsin still receive funding through the tobacco settlement? The answer is no. And a lot of this is, I'm glad you asked this question. And I thought I saw Jenna's on here too. So who's one of our coordinators. So, Jenna might have thoughts or experience in navigating this with elected officials. A lot of people think that the program still receives funding through the tobacco settlement, and that's not true. I might get some of these words wrong, so bear with me, but I don't know, maybe 10 years ago, I'm guessing, but before Mike and I were in our current roles, the interim governor at the time, and I'm totally blanking on his name, used tobacco settlement funds to balance the budget, and so use those funds to make up budget shortfalls, and so those funds no longer exist in our state. Any other questions? So Hannah asked who regulates the law when it comes to preemption. Seems like locally something should be okay when federally it isn't. So essentially, if I'm understanding your question right, and Mike, please feel free to jump in, is that, if a higher level of government says that the local, level of government can't do it, that's who is regulating that piece of the law. which is super challenging because we do live here in Wisconsin in a home rule state. So it feels very counter to many of the things that are already in place with our systems. I don't know, Mike, if you have more thoughts.
Yeah, and how that plays out is it's written into policy. It's written into legislation. So that's where you start to see lawsuits coming in when a lower level of government tries to pass a policy that's preempted. So it's essentially written into legislation. And what is a home rule state? So home rule state is, so here in Wisconsin, the local level is, I'm trying to think how to explain it.
Yeah, like generally on most cases would hold more power.
Yeah.
Right. So like, unless it's like explicitly stated in state law that they don't, usually the local government would have the authority, maybe that's the way to say it, the authority to do what they need to do. So the state doesn't say, actually tobacco-free schools is a really good example. So each individual school district within your municipality has the authority to say, we're going to set our own policies versus the state saying like, it has to be this. I hope that makes sense.
Another way to maybe think about this is typically when there's some sort of emergency, the state can't just come into a county and say, hey, we're running the show here. It's really the local jurisdiction that has the authority to respond to that emergency. Now they might say, hey, state of Wisconsin, we need your help. Please come help us. But the state has to defer to the local level in that case.
Yeah, that's a good example, Mike.
Yeah.
Any other questions? Well, like Mike said before, please contact us if you have questions. We're happy to set up a time to chat. If you want to call us and you have a quick question, happy to provide that support. We may not know the answer, but we can try to track down the answer. And I hope this was helpful to you in getting a lot of information in a short amount of time. So I'll pause there and pass it to you, Megan.
Awesome. Well, thank you guys both so much. This was, super informative. And for those of you who would like to absorb this information again, we did record it and we'll be putting that on the webinar, the Northwest Coalition webinar series webpage, and we can send it out too if that's easier. So yeah, feel free to reach out to myself or Carleigh or Mike if you do have any questions. But thank you guys so much for being on today. And we hope you will join us next month for our next webinar. But thank you all.
Megan, I actually have a question, but I was in the middle of typing. It's a long question. This is Sharon from Glitzy. Do you have like a communication network when there are public hearings related to tobacco? Because it's hard to keep up with the hearings because they're happening so quickly, but it is a great opportunity to be able to give comment. Not just that, but I also just wanted to remind people that when the agencies are asking for public comment, when they're specifically pass the bill, when they're in the rulemaking process, they oftentimes open for public comment. So I just didn't know if there was a tobacco-related communications network where that information can go out, that there's this, it's, you have time to provide your input.
Yeah, thanks for asking that, Sharon. I was just trying to pull up the website. So I don't know if Mike used something different, but I sign up for legislative alerts on the Wisconsin State Legislature webpage. And what you can do is put in keywords
yeah, I've tried that. It's just that it sends you too much information. So that's why I was wondering if somebody else was filtering that out for tobacco specific, to get that out. There's so much going through the legislature, basically, and tobacco could be mixed into something else, whatever. I get way too many emails. That's what it amounts to.
Yeah.
So,
Yeah,
Would,
go ahead, Mike.
no, I was just gonna say, would the best approach maybe just to get connected with your local coalition? You
Yeah,
know,
that would be a good idea too.
yeah,
I think the
I just don't think, I don't know if they have that capability, at the local level to keep up with all the legislation, basically. I can check with Sue and see. And with
Yeah.
Melissa Dowd at Glitzy.
Yeah, for sure. Yeah,
But it
Melissa would be a great person to ask.
Yeah, but I mean, it would be good for others in this, related to tobacco, not just from Great Lakes standpoint, I did just want to remind people, because we often forget that when the agencies do solicit for response to or provide information on the federal level, those are listed in the Federal Register. On the state level, I don't know how that comes out. So it would be just interesting to see if there was any way to just streamline that communication so people get the information as quickly as possible. Oftentimes it's just such fast turnaround on things.
Yeah, you're right. It moves super fast. And it's
Yes.
it is like, I mean, just to be really transparent, like Mike and I, this is our full-time job and it moves that fast. So when you're trying to manage lots of different things, it's really hard. And I was just going to say too, the three main advocacy partners who advocate on tobacco prevention and control issues are the American Heart Association, the Lung Association, and the Cancer Society. And they also, you can sign up for their action alerts. And they will also put out notes when there is something, but you wouldn't necessarily get like, the legislature has, like, you wouldn't necessarily get like the budget has all of these policies in it, but if they have something really rising to the top, that would be another way to get plugged in. And I saw Jenna put in the chat about signing up for statewide coalition updates. And you could also do that. I can grab that link in a second.
Yeah, thank you, Carleigh. I was just trying to find that link.
I got another question, I think was maybe accidentally private message to me, so I'm going to read it out loud because it might be helpful for others. So this person is saying that they're experiencing a language change when speaking to friends and young adults about youth and tobacco prevention, that there's this disassociation between tobacco and tobacco-free / 100% nicotine products. And if we are seeing anything develop around this. So the answer is, yeah, this is a huge issue. So I think it's really deceptive, and the language that's used makes it feel like, if it's a certain word and it's not cigarette, right, which has really had a different kind of connotation over the years, people think it's not as bad. And so the short answer is yes, that's definitely going on. And the language is challenging to educate around and keep up on. And I think for people, who are not us, right, who are trying to understand the lingo, people in the public, that can be challenging as well. So if you have more questions on that, let us know. Oh my God. Great.
Yeah, Carleigh, and I believe this is the right page to link to. I linked to the Join Us page. So if someone's interested in signing up, that's where you would sign up.
Right. Yep. Thank you.
Yep.
Okay, well, thank you guys both again. And yeah, feel free to sign off now, and we will post the webinar recording as soon as it is available. So thank you guys.
Thank you.
Thanks.